Fire is not something you expect in a dental chair, not even remotely, especially when the patient is 5 years old, asleep, motionless, trusting. And yet, that's exactly what happened. In 2019, in Las Vegas, a routine pediatric dental visit turned into something that still feels unreal to read about. A little girl, her name never made public, was brought to a children's dental clinic to have a few crowns placed on her baby teeth. Nothing dramatic, no emergency, just maintenance, the kind of appointment parents don't lose sleep over. She was put under general anesthesia. She drifted off. The dentist began working. As usual, a throat pack was placed in her mouth, soft gauze meant to protect the airway, a safety measure. One of those things no one questions because it's been done this way for decades. Then the drill came out, a diamond burr, spinning fast enough to grind enamel into dust. At that speed, friction is inevitable, and friction creates heat. What happened next took less than a second. A spark jumped from the burr, just one. It landed on the gauze, and the gauze caught fire inside the mouth of a sleeping child. According to court documents, the flames lasted only 1 to 2 seconds. But time works differently when tissue is burning. By the time the fire was put out, the damage was already done. Emily, let's call her that, was rushed to University Medical Center. Doctors examined her mouth, her throat, her airway. What they found was disturbing. Burns to the lower lip, burns to the palate, burns to the tongue, and most concerning of all, damage to the epiglottis, that tiny flap of cartilage that protects the airway when you swallow. If it fails, a person can choke, they can struggle to breathe, they can lose the ability to eat or speak normally. Emily spent 4 days in the hospital. She was discharged. Then the pain returned. A week later, she was back, this time with hearing problems, likely caused by swelling and inflammation. She stayed another 9 days, 13 days in the hospital, for crowns. Dental fires are so rare that many dentists go their entire careers without even hearing about one. Across all operating rooms in the United States, not just dentistry, surgical fires occur an estimated 20 to 100 times per year. But inside a mouth, that's almost unheard of. So how did this happen? It comes down to something called the fire triangle. 3 elements: fuel, oxygen, ignition. In this case, all 3 were present in the same place at the same time. The throat pack, fuel, supplemental oxygen from anesthesia, far more than normal air, and the diamond burr, the ignition source. One spark was all it took. If the fire had lasted longer, the outcome could have been catastrophic. Deep airway burns, permanent damage to the vocal cords, swelling severe enough to block breathing entirely. The parents filed a lawsuit against the dentist and the clinic, seeking damages for medical costs and long-term consequences. An expert witness later wrote that the conditions created during the procedure were, in his words, explosive. The dentist declined to comment. No disciplinary action was on record at the time. And the girl? She survived. She recovered. But here's what I can't stop thinking about. This wasn't a risky operation. It wasn't experimental. It wasn't extreme. It was the kind of dental appointment parents schedule without a second thought. And yet, for 1 second, fire appeared where it should never exist. One spark, one moment, and a reminder that even the most routine procedures can still go horribly, unpredictably wrong.